There does seem to be this element of wanting to be present on both sides of the aisle, for that matter, in case something happens. What's happening today for you on Capitol Hill?
Yeah, well, sadly, I'm going to be, not sadly that I'm going home, but I'm going to be going home in a little while. I had some meetings this morning I wanted to make sure that I was present for. So not much happening here, though. We were here in the House, and House Republicans didn't come back to Washington. So after a few days, it seemed prudent to go back and talk to folks who are going to be impacted by all of what's going on.
So, Congressman, can you give us any sort of inside view? Are there any negotiations happening right now behind closed doors? Are we any closer to solving this to get the government reopened?
Yeah, I don't think we're very much closer than we were the last day or two. I think what will happen is people will go home. They're going to talk to constituents. I think they're going to get a feel for how people feel impacted by that. And hopefully next week, our friends on the Republican side will recognize that if you want people to compromise, you have to sit down and find common ground. And we are very committed to the idea that the health care changes that have been made over the last several months, where nearly 20 million Americans will be either have no health insurance any longer or will be paying double or triple what they're currently paying in premiums, is untenable. And we want our Republican friends to understand that destroying the health care system and, frankly, using that money instead to benefit literally the wealthiest of Americans isn't something that's in the interest of the American people.
You're, of course, on the Appropriations Committee, Congressman. If somehow there's a deal and we get a CR through Thanksgiving, roughly, would it be possible to come out of that period of time with an actual budget based on spending bills looking something like regular order?
You know, Joe, it's a great question. I mean, I marvel at this. Unfortunately, Congress has rarely in the last 30 years been able to pass appropriation bills, which is the true spending plan. And instead, we have these continuing resolutions which kick the can down the road. Frankly, if I had my druthers, we'd be working on the 12 appropriation bills which fund the government full time. That's really what we ought to be focused on. And instead, we're here on a short-term spending plan that doesn't meet anyone's needs, and we get caught up. It's kind of the Washington inside the Beltway problem, and I think we need to address the structural long-term issues of getting spending plans done at the start of the fiscal year.
So in order to get that on track and ultimately reopen the government, I want to go back to what you were saying about Democrats holding firm when it comes to health care priorities. What specific enforcement mechanism are you looking for from the GOP in order to agree to a deal that would ultimately reopen the government and lead to those negotiations? Or does all this have to be sorted before that can happen?
Yeah, Tyler, it's a great question. I think there's two things that concern us. One is the actual cuts. I mean, the reconciliation bill basically jeopardizes 15 million Americans' health insurance. The bill before us right now that we're being asked would probably add another 4 million Americans to the rolls of the uninsured. So there is that issue and how we deal with it. Second is that the administration seems to do whatever it wants without regard to what Congress says. So Congress has the power of the purse. We talk about it all the time. Article 1 of the Constitution gives that authority to the Congress. But even when Congress appropriates with the president money in accordance with the law, the president has impounded money. He's done pocket rescissions. So the second part of it is, once we reach a deal on substance, how do we guarantee that the president doesn't renege on the things we all agree to? He is notoriously bad at upholding his end of the deal whenever he reaches a bargain. And that's a real problem, not just for now, but that's a real problem going forward.
Well, I'm glad that you brought up the timeline there, because realistically, these are complex issues that need to be hammered out. What sort of timeline do you think that this could actually get done?
Well, look, I think when people of goodwill are committed to it, you can move mountains, and I think we need to do that. The problem is we're so far apart right now. And look, I don't even think this is Democrat values. These are American values. I think people back in our communities, they want us to fight for lower costs, and lower costs means lower health insurance premiums. It means being able to provide health care for your family, for your children. If something goes wrong, and by the way, whether you have health insurance or not, you're going to go to a hospital if you have a child who's sick. But what that does is it impacts the ability of hospitals to do their job well and puts them on the brink and sometimes of insolvency. So this isn't just a problem of people on Medicare or Medicaid or on the Affordable Care Act insurance plans. It really affects all Americans, and that's why we're so committed to this. But I do think if people of goodwill sit down, we can work this out, but you have to have the will to do it.
What's going on in your office, Congressman? Are you able to take constituent calls? Is your staff showing up without being paid?
They are showing up, and they're all essential in my mind. They do all the great work that we need to do. So we're working. We've talked to them about what to expect, but they're working hard, and they know how important this moment is. And I'm kind of anxious to be back in Rochester, to be at Wegmans or to be at the dry cleaner, and in addition to all the official meetings we have, of course, just to hear what people have to say and what their concerns are and what their fears are. This is an important moment. And look, we're going to have to figure out a way in this moment to bring people together in Congress and in the country. I am deathly afraid of what's happening in America, where people are picking sides before they even know the facts, just based on what they think their tribe has to say or their team has to say based on their political views. This is really, I think, a troubling point in American history. And I would look to the president. He has the opportunity to unify people, bring people together, but I don't think you can do it by demonizing people. I don't think you can do it by saying, I hate my enemies, I hate my opponents. In this moment, I just think that is such a divisive and frankly counterproductive position to take.
In the final minute we have with you, Congressman, you mentioned Rochester. You represent New York's 25th district. We have seen the White House pull some federal funding for projects in New York City. Are you concerned at all about the administration making similar moves in your district?
Yeah, look, he has canceled in the last 24 hours 223 projects across the United States. You know, 216 are in blue states, 7 are in states that he won. So, I mean, the president is really weaponizing this and using it as a way to go after both political enemies. He perceives adversaries. He uses the government in a way no president of any party has ever done before. And I think when Americans see that, that's not what we're about as Americans. We're about fair play. We're about trying to get together and making this thing work. And so I'm definitely concerned. I mean, the Second Avenue subway and other projects are on hold or have been canceled. So we got a lot of work to do.